The LIFEPAK 35 monitor defibrillator provides non-invasive pacing using adult or pediatric quick combo ECG electrodes. Non-invasive pacing delivers electrical current to the heart to elicit cardiac depolarization and myocardial contraction. The LIFEPAK 35 monitor defibrillator can provide both demand and non-demand pacing. To perform non-invasive pacing, first, power the device on. When performing demand pacing, it is important to ensure you have both your ECG cable and therapy cable attached to the patient to ensure proper sensing of the intrinsic rhythm. If the therapy cable is not already connected, connect it at the top of the device. Connect the therapy electrode pads to the therapy cable. You should prepare the patient's skin for therapy electrode pad placement. Apply the therapy electrode pads to the patient's chest in the anterior lateral or anterior posterior position. Then attach the ECG cable and place the ECG limb electrodes on the patient. Press therapy. Press the pacing button. The pacing controls will appear. Abbreviated instructions are available should you need guidance on pacing programming. To access the abbreviated instructions, press the blue circle with the question mark in the middle of it. The abbreviated instructions include directions for non-invasive pacing. To close the abbreviated instructions, press OK. The pacing mode, demand or non-demand, will be shown in the top therapy message line. You can change their pacing mode by selecting the gear icon. The pacing status, stopped, on, or paused will be shown in the bottom therapy message line. Continuing in demand mode, providers can now confirm the patient's ECG rhythm. Take care to confirm that a triangle sense markers appear near the middle of each QRS complex. If the sense markers do not appear or are displayed in the wrong location, select another limb lead in channel 1. If necessary, adjust the ECG size. You can now adjust the rate using the up-down arrows. The dial on the touchscreen can also be used to adjust the pacing rate. The speed dial can also be used to adjust the pacing rate. If your device is set up with the default current at 0, you will need to increase the pacing current to begin pacing. You can also increase the pacing current using the up-down arrows, the on-screen dial, or the speed dial. If your device is set up so that the default current is greater than 0, you must press the Start button to begin pacing. You can now increase current until electrical capture occurs. Mechanical pacing capture should also be confirmed by assessing the patient's physiologic response to the programmed pacing output. Palpate patient's pulse, check blood pressure, or consider use of SpO2 pleth waveform or ETCO2 to confirm mechanical capture. When pacing in non-demand mode, the ECG electrodes are not required given that sensing is no longer active. Non-demand pacing occurs at a fixed program rate independent of the patient's intrinsic underlying rhythm. To view the patient's underlying intrinsic rhythm while pacing in either mode, you can press and hold the pacing pause button to temporarily slow to 25% of the program pacing rate. After 15 seconds, the button releases automatically. Should you need to pause pacing for additional time, utilize the speed dial to select and hold the pause button. To view all monitoring parameters during pacing, press the collapse button next to the pacing tab or press home in the bottom right corner of the screen. While pacing is active, the pacing status will always be displayed in the message area at the top of the home screen. To return to the pacing screen, press Pacing in the bottom right corner of the screen. To stop pacing, press Stop or Reduce Current to 0. Should you need to restart pacing, simply increase the current output. Thank you for watching the LIFEPAK 35 pacing video.